In this edition of Ask the Doc, I got a question from someone that has a confirmed partial tear of their rotator cuff muscle and is trying to decide if surgery is going to be a good option for them. I cover the following in this video: questions to ask yourself about how the injury occurred, why the tear happens in the first place, why getting a cortisone injection could make the problem worse, is surgery the best option, and what are the potential side effects of it? And lastly, what I would do if I had the same injury presentation. I'm back at it for Ask the Doc. If you don't know who I am, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and then reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long-lasting pain relief. All right, so just a reminder, you can send all your questions about neck, shoulder, elbow, and wrist injuries in to us, and I will do my best to give some real honest answers if I think I can help. The question this week was, I have been dealing with some shoulder pain on and off for the past few years. Nothing too bad. A few months back, I started getting back into yoga and noticed more and more discomfort building up in the shoulder. I just figured my body was adjusting to new positions and exercises. One day I woke up and could barely lift my shoulder, and reaching for anything gave me some intense pain. I waited a few days to see if it would improve, but just kept getting worse. I went to my primary doctor and they referred me right away to an orthopedic doctor. They did a full exam on me, told me I had a tear in my rotator cuff, and gave me a cortisone injection, which hurt like hell and did take some of the pain away. Once the swelling was gone, I was sent for an MRI, which revealed a partial tear of my supraspinatus muscle and bursitis. I tried a few visits at physical therapy, but everything just hurt, and the provider said they couldn't help me as it seems to be too far gone. Now the doctor wants me to do surgery to repair it, and I'm worried about the whole process. I am only 33 years old and and I'm very active. Doing my research on the internet, it seems this surgery might not work and I might need more surgery after. I just wanted to do what is best for me in the long run, and any advice and insights would be greatly appreciated. Thanks so much for sharing that question, and really sorry to hear that you're dealing with all this, but I'm glad you reached out. So, one of the first things that I always like to consider when I'm doing an evaluation on somebody with a shoulder injury, particularly a partial tear of the supraspinatus. So, just a quick idea: the idea of your rotator cuff, it's actually three different muscles. One of them is a muscle in the front in your armpit called your subscapularis. Then you have one that goes over the top called your supraspinatus. And then you have your infraspinatus and your teres minor. I know I said three, I'm at four muscles. Sometimes I get a little wonky when I'm doing anatomy. The one that's being torn here is the most common one of the supraspinatus tendon. And a big question you want to ask yourself is, how did the injury occur in the first place? And one thing that I don't like to treat is someone that has some acute trauma or maybe an accident. Maybe they fell, maybe they got in a car accident and that muscle and that tendon tore. But a lot of times what happens is there's no like true mechanism for the injury, and it just starts to tear and eventually it starts to hurt. It almost like feels like it came out of nowhere. So what I always want to know was there trauma or was there not? If there was no trauma, and it just seems like a repetitive overuse and a compensation thing, a lot of times surgery is going to be counterproductive because that tear is happening because other things are not moving correctly. So why do these tears happen in the first place? I talk about this a lot in all my videos. There's this stuff that forms in the muscle. It's called scar tissue. It's like glue that gets inside the muscle. A lot of people go, well, I didn't have a direct injury. How do I get scar tissue? Well, you can actually get scar tissue just from overuse when your muscles are getting stretched too much. Maybe you're in bad posture. Maybe you're working out too much, just beating your muscles up. They don't get enough blood flow. They don't get enough oxygen. And what happens is the body starts to lay down this stuff called scar tissue to try to buffer and repair the area and help the muscle out. But over time, that scar tissue gets in there and makes the muscle less flexible and weak. And then eventually what happens is it puts more pressure on the joint and the cartilage and the tendon, and then someone has rotator cuff damage and injury to the shoulder joint itself. Usually the first muscle where I'm going to find this occur is in what's called the infraspinatus. It's on the back part of the shoulder blade, and it's really important in a motion called external rotation, moving your shoulder in and out, and also reaching and lifting your shoulder up as well. That's the most common area where that scar tissue happens at first. And the job of the supraspinatus, the job of the infraspinatus is to provide movement, but also stability for the shoulder. Then eventually it gets caught up in the back part of the joint here in what's called the capsule. And when the capsule gets overstretched, overworked, it doesn't provide enough stability and motion and anchor the shoulder properly. Then it puts more pressure on the tendons, on the joint itself. And then lastly, it starts to form in the supraspinatus, but a lot of that pressure already went to the tendon out there as well. And the job of the supraspinatus is really just to lift the arm up just like this. And over time, it starts doing other jobs of the shoulder that it's really not designed to do. And when that happens, it puts more wear and tear on the tendon. Then you get that partial tear in there, which is what happened in this situation. Now, cortisone shots, I understand it's the go-to for orthopedic doctors. They love it. They love pumping people full of cortisone. They'll give you this magic shot and all your problems will be gone. Nope, not the case. Yes, it does take away some pain, but it didn't fix anything. And they've shown over and over and over again in studies that repeated cortisone shots actually cause more of that tendon damage to occur. So when this person is getting a tear, they're not getting it in the muscle, they're actually getting it in the tendon because the tendon is getting overworked. And the cortisone shots actually make that tendon weaker and it's more susceptible to tearing. So is surgery the best option? No, it's not. It should never be the first option, but so many people jump to this as well. You get an MRI and it looks scary and the surgeon's like, yep, we're just going to go in there, sew it up, fix it up. You'll be good to go. They never tell you of all the other potential side effects. You could have a reaction to the anesthesia. You could get an infection. The surgery might not actually work. It could actually make it a lot worse. They also don't tell you that you're going to be in a sling for a long time. You're going to have trouble getting dressed. You're going to have other people help you with things. You're going to have to go do a bunch of physical therapy afterwards. The problem for these surgeons are they just go, hey, it's just going to be in and out. We'll clean it up and you're good to go. And the problem is that's not the case, especially in this situation, because there was no direct trauma. What's going on is all the other muscles in the rotator cuff, like I said, in the infraspinatus, the teres minor, the subscapularis, and the capsule are loaded up with that scar tissue. And then the tendon that is having that partial tear is like your thumb and it's stuck inside a car door. The car door is all of that bad tissue out there. We can't give this a chance to heal up until we remove that. And that's what's happening. So that's the issue here, is that the tear in the shoulder is the effect, but it's not the cause. The cortisone is making it worse, and then jumping into surgery right away. And if they only fix the tear, but they don't fix anything else around there, it's going to be like slamming that car door right back in there again. That's why these cases, especially where there's no direct trauma, don't do well. And that's what the research has shown on the internet, is that they don't do well, but they go, hey, MRI, bad tendon, let's just sew it up and you'll be good to go. Bill your insurance for about 20 grand and call it a day, and you're still dealing with a problem. So what would I do if I had the same injury presentation? I'd get all my muscles cleaned up by a focused soft tissue provider that can go in and break down that scar tissue, clean that up as much as possible, get as much range of motion in there as possible, then start to build up some strength and some stability around the area. I'd also do a lot of work in my mid-back and my thoracic spine because they go hand in hand, and I try to get this in a good place. I'd get that car door off of that tendon and give it a chance to heal up. And if it didn't heal up, then maybe I'd consider things. I wouldn't actually consider surgery because the risk factors are just so high with infections and reactions into not working. Maybe then I try some stem cell therapy and see what happens to help regenerate the tendon. But a lot of times, if you get all that bad tissue out there, you get it moving better, you get it functioning better, it's not going to be a problem. So that's all I got for you guys in the video. One thing I want to just leave you with is always get multiple opinions and never be in a rush to jump right into surgery. Be patient and carefully weigh all the options and understand that surgery should never be the first option, but the last. If you've been dealing with a shoulder injury, gotten jerked around by the medical system, never got any real results, and the problem is still getting worse, the first step is to get a clear idea of what is going on and an accurate diagnosis for the problem. Because if you don't know what the problem is in the first place, you sure as hell can't fix it. We offer online consultations for anyone that is unable to come into my own clinic, and also have a large network of awesome providers all over the country we can refer you to, so we can get you on the path to functioning and feeling a heck of a lot better. Thanks for watching, and I'll see you guys on the next one. Bye.